The 2019 to 2020 coronavirus pandemic is an ongoing global pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak first emerged in Wuhan, Hubei, China in December 2019 and was declared a pandemic by the World Health Organization WHO on 11th March 2020. As of the 14th of March, over 155,000 cases have been reported in around 130 countries and territories. More than 5,800 people have died and over 74,000 have recovered. Regions affected by major outbreaks include mainland China, South Korea, Iran, Italy, and Spain. On 13th March 2020, the WHO declared Europe as the epicenter of the pandemic. The virus primarily spreads between people in a way similar to influenza, via respiratory droplets from coughing. The time between exposure and symptom onset is typically 5 days, but may range from 2 to 14 days. Symptoms are most often fever, dry cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is currently no vaccine or specific antiviral treatment, but research is ongoing. Efforts are aimed at managing symptoms and supportive therapy. Recommended preventive measures include hand washing, maintaining distance from other people, particularly those who are unwell, and monitoring and self-isolation for 14 days for people who suspect they are infected. Public health responses have included travel restrictions, quarantines, curfews, event cancellations, and facility closures. These include a quarantine of the Chinese province of Hubei, the nationwide quarantine of Italy, the nationwide quarantine of Spain, curfew measures in China and South Korea, various border closures or incoming passenger restrictions, screening methods at airports and train stations, and travel advisories regarding regions with community spread. Schools and universities have closed either on a nationwide or a local basis in at least 61 countries, affecting more than 421 million students. Effects of the pandemic include social and economic instability, xenophobia, and racism against people of Chinese and East Asian descent, and the online spread of misinformation and conspiracy theories about the virus. On 31st of December 2019, a cluster of pneumonia cases of unknown cause was reported by health authorities in Wuhan, the capital of Hubei province, China, and an investigation was launched in early January 2020. These cases mostly had links to the Huanan seafood wholesale market, which also sold live animals. Consequently, the virus is thought to have a zoonotic origin. The virus that caused the outbreak is known as SARS-CoV-2, a new virus that's closely related to bat coronaviruses, pangolin coronaviruses, and SARS-CoV. It is believed that the virus possibly originated in bats of the rhinolophus gene. The earliest reported symptoms occurred on the 1st of December 2019 in a person who had not had any exposure to the Huanan seafood wholesale market or the remaining 40 of the first cluster detected with the new virus. Of the early cluster of cases reported in December 2019, 2/3 were found to have a link with the wet market. More recently, on the 14th of March 2020, Chinese news announced that the first confirmed case of the COVID-19 disease caused by the SARS-CoV-2 virus has been traced back to a 55-year-old patient in Hubei province and was reported in a Chinese newspaper on 17th November 2019. To date, 14th March 2020, 67,790 cases and 3,075 deaths due to the virus have been reported in Hubei province, a case fatality rate, CFR, of 4.54%. On the 26th February 2020, the WHO reported that, as new cases reported dropped in China but suddenly increased in Italy, Iran, and South Korea, the number of new cases outside China had exceeded the number of new cases in China for the first time. As of the 26th of February, very few cases have been reported in children. A report from WHO noted that those 19 and under made up just 2.4% of cases worldwide. Among those who died from the disease, the time from development of symptoms to death has been shown to be between 6 and 41 days, with a median of 14 days. As of the 14th of March 2020, more than 5,800 deaths have been attributed to COVID-19. According to China's NHC, most of those who died were elderly. About 80% of deaths were in those over 60, and 75% had pre-existing health conditions, including cardiovascular diseases and diabetes. The first confirmed death was on 9th January 2020 in Wuhan. The first death outside China occurred on the 1st of February 2020 in the Philippines, and the first death outside Asia was in France. As of the 20th of February 2020, outside mainland China, more than a dozen deaths have been recorded in each of Iran, South Korea, and Italy. Deaths have also been reported in North America, Australia, San Marino, Spain, Iraq, and the United Kingdom. By the 13th of March 2020, over 40 countries and territories had reported deaths on every continent except Antarctica. Symptoms of COVID-19 are nonspecific, and those infected may either be asymptomatic or develop flu-like symptoms such as fever, cough, fatigue, shortness of breath, or muscle pain. The typical signs and symptoms and their prevalence are shown in the corresponding table. Further development can lead to severe pneumonia, acute respiratory distress syndrome, sepsis, septic shock, and death. Some of those infected may be asymptomatic, returning test results that confirm infection but show no clinical symptoms. So researchers have issued advice that those with close contact to confirmed infected people should be closely monitored and examined to rule out infection. The usual incubation period, the time between infection and symptom onset, ranges from 1 to 14 days. It is most commonly 5 days. In one case, it had an incubation period of 27 days. The primary mode of transmission is via respiratory droplets that people exhale, for example when coughing or sneezing. Droplets only stay suspended in the air for a short time, but may stay viable and contagious on a metal, glass, or plastic surface. Details for the virus are not available as of the 26th of February 2020, and it is assumed that they are similar to other coronaviruses, which survive for up to 9 days at room temperature. Disinfection of surfaces is possible with substances such as 62 to 71% ethanol applied for 1 minute. The WHO has stated that the risk of spread from someone without symptoms is very low and that fecal transmission is low. However, an analysis of infections in Singapore and Tianjin in China revealed that many coronavirus infections may be spread by people who have recently caught the virus and have not yet begun to show symptoms. This finding means that isolating people once they start to feel ill is less effective than hoped. There have been estimates for the basic reproduction number, the average number of people an affected person is likely to infect, ranging from 2.13 to 4.82. This is similar to severe acute respiratory syndrome related to coronavirus, SARS-CoV. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is a novel severe acute respiratory syndrome coronavirus, first isolated from 3 people with pneumonia connected to the cluster of acute respiratory illness cases in Wuhan. SARS-CoV-2 is closely related to the original SARS-CoV. It is thought to have a zoonotic origin. Genetic analysis has revealed that the coronavirus genetically clusters with the genus Beta-coronavirus and subgenus Sarbecovirus, lineage B. Together with 2 bat-derived strains, it is 96% identical at the whole genome level to other bat coronavirus samples, BAT-CoV RATG13. In February 2020, Chinese researchers found that there is only one amino acid difference in certain genome sequences between the viruses found in pangolins and those from humans, implying that pangolins may have been an intermediate host. Infection by the virus can be provisionally diagnosed on the basis of symptoms, though confirmation is ultimately by reverse transcription polymerase chain reaction, RRT-PCR, of infected secretions, 71% sensitivity, and CT imaging, 98% sensitivity. The WHO has published several RNA testing protocols for SARS-CoV-2, with the first issued on 17 January. Testing uses real-time reverse transcription polymerase chain reaction, RRT-PCR. The test can be done on respiratory or blood samples. Results are generally available within a few hours to days. A person is considered to be at risk if they have traveled to an area with ongoing community transmission within the previous 14 days or have had close contact with an infected person. Common key indicators include fever, coughing, and shortness of breath. Other possible indicators include fatigue, myalgia, anorexia, sputum production, and sore throat. Characteristic imaging features on radiographs and computed tomography have been described in a limited case series, and the Italian Radiological Society is compiling an international database of imaging findings for confirmed cases that is available online. However, due to overlap with other infections such as adenovirus, imaging without confirmation by PCR is of limited use in identifying COVID-19. Prevention suggestions include good hygiene, such as washing hands when appropriate, avoid touching the eyes, nose, or mouth with unwashed hands, coughing or sneezing into a tissue and putting the tissue directly into a dustbin, and for those who may already have had the infection, wearing a surgical mask in public. Social distancing measures are also recommended to prevent transmission. Many governments advise against all non-essential travel to countries and areas affected by the outbreak. China has banned the trading and consumption of wild animals. For healthcare providers taking care of someone who may be infected, standard precautions, contact precautions, and airborne precautions with eye protection are recommended. Contact tracing is an important method for health authorities to determine the source of an infection and to prevent further transmission. Misconceptions are circulating about how to prevent infection. Rinsing the nose, gargling with mouthwash, and eating garlic are not effective. Hand washing is recommended to prevent the spread of the disease. The U.S. Centers for Disease Control and Prevention, CDC, recommends that people wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating, and after blowing one's nose, coughing, or sneezing. If further recommended using alcohol-based hand sanitizer with at least 60% alcohol by volume when soap and water are not readily available. The WHO also advises people to avoid touching the eyes, nose, or mouth with unwashed hands. Health organizations recommended that people cover their mouth and nose with a tissue when coughing or sneezing, which should then be disposed of immediately, or with a sleeve if the tissue is not available. Masks are not recommended for most people. There's limited evidence that the wearing of surgical masks by uninfected people at low risk is effective, although they may help people avoid touching their face. Surgical masks are the lowest grade of protection, are designed mainly to protect others from the wearer. Masks designed to protect the wearer are technically respirators, though calling them masks is common. Only China has specifically recommended the use of masks by healthy members of the public. Nevertheless, face masks have been widely used by healthy people in Hong Kong, Japan, Malaysia, and Singapore. The use of surgical masks by those who may be infected has been recommended, as they can limit the volume and travel distance of expiratory droplets dispersed when talking, sneezing, and coughing. The WHO has issued instructions on when and how to use masks, including cover mouth and nose with mask and make sure there are no gaps between the face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp, and do not reuse single-use mask. Remove the mask using the lace from behind. Do not touch the front of a mask. Discard immediately and clean hands. Masks have also been recommended for use by those taking care of someone who may have the disease. An N95 mask with eye protection is recommended when aerosol-generating medical procedures are carried out. Self-isolation at home has been recommended for those diagnosed and those who suspect that they have been infected. Among other instructions, the CDC advises individuals in self-isolation to stay at home except to get medical care, call ahead before visiting a doctor, do not go to work, school, or public areas, and avoid using public transportation. Wash hands often. Cover coughs and sneezes with a tissue, and if sick, wear a face mask around others. Stay separated from other people and animals at home. Avoid sharing personal items. Use a separate bathroom if available. Use a household cleaning spray or wipes to clean all frequently touched surfaces every day. Those who have recently traveled to a country with widespread transmission or who have been in direct contact with someone diagnosed with COVID-19 have also been asked by some government health agencies to self-quarantine or practice social distancing for 14 days from the time of last possible exposure. Social distancing includes infection control actions intended to slow the spread of disease by minimizing close contact between individuals. Methods include quarantines, travel restrictions, and closing schools, workplace, stadiums, theaters, or shopping centers. Individuals may also apply social distancing methods by limiting travel, avoiding crowded areas, and physically distancing themselves from sick individuals. Many governments are now mandating or recommending social distancing in regions affected by the outbreak. Older adults and those with serious chronic conditions face increased risk of serious illness and complications and have been advised by the U.S. CDC to avoid crowds and stay home as much as possible in areas of community outbreak. Some countries like Canada or the U.S. issued guidelines to not shake hands, hug, or kiss. Some countries like India have recommended to its citizens that spitting in public places should be avoided. As of the 13th of March 2020, there is no vaccine against COVID-19. A number of private companies and research institutions are developing vaccines. An international research program coordinated by Coalition for Epidemic Preparedness Innovations has identified and is funding development of 3 possible vaccine candidates. Nevertheless, none of these is expected to complete clinical trials before 2021. A key part of managing an infectious disease outbreak is trying to decrease the epidemic peak, known as flattening the epidemic curve. This helps increase the risk of health services being overwhelmed and providing more time for a vaccine and treatment to be developed. Non-pharmaceutical interventions that may be taken to manage the outbreak include personal preventive measures as described in the section above, such as hand hygiene, wearing face masks, and self-quarantine. Community measures aimed at social distancing, such as closing schools and canceling mass gathering events, community engagement to encourage acceptance and participation in such interventions, as well as environmental measures such as cleaning of surfaces. More drastic actions were taken in China once the severity of the outbreak became apparent, such as quarantining entire cities affecting 60 million individuals in Hubei and strict travel bans. Other countries adopted a variety of measures aimed at limiting the spread of the virus. For example, South Korea introduced mass screening, localized quarantines, and giving alerts on the movements of affected individuals. Singapore provided financial support for those infected who quarantined themselves and large fines for those who failed to do so, while Taiwan increased face mask production and penalized hoarding of medical supplies. Some countries require people to report flu-like symptoms to their doctor, especially if they have visited mainland China. There are no specific antiviral medications, but development efforts are underway. Attempts to relieve the symptoms may include taking regular, over-the-counter, cold medications, drinking fluids, and resting. Depending on the severity, oxygen therapy, intravenous fluids, and breathing support may be required. The use of steroids may worsen outcomes. Several compounds which were previously approved for treatment of other viral diseases, such as favipiravir, ribavirin, remdesivir, and galidesivir, are being investigated. The first known case of the novel coronavirus was traced back to the 1st of December 2019 in Wuhan, Hubei, China. A later, unconfirmed claim citing Chinese government documents suggests that the first victim was a 55-year-old man who fell ill on the 17th of November 2019. Within the next month, the number of coronavirus cases in Hubei gradually increased to a couple hundred, before rapidly increasing in January 2020. On the 31st of December 2019, the virus had caused enough cases of unknown pneumonia to be reported to health authorities in Wuhan, the capital of Hubei province, China, and an investigation into the illness began early in the following month. These were mostly linked to the Huanan seafood wholesale market, which also sold live animals. Consequently, the virus was thought to have a zoonotic origin. During the early stages, the number of cases doubled approximately every 7.5 days. In early and mid-January 2020, the virus spread to other Chinese provinces, helped by the Chinese New Year migration, with Wuhan being a transport hub and major rail interchange in China. Infected people quickly spread throughout the country. On the 20th of January, China reported nearly 140 new cases in a day, including 2 people in Beijing and 1 in Shenzhen. Later official data shows that 6,174 people had already developed symptoms by the 20th of January 2020. On the 30th of January, the WHO declared the outbreak to be a public health emergency of international concern. Its director, Tedros Adhanom, has maintained his praise of China's response to the virus as of 24th of February to avoid a significant number of cases, despite the disease's potential to sustain community transmission in other world regions. As of the 14th of March 2020, more than 155,000 cases have been confirmed worldwide. There is thought to be a substantial underreporting of cases, particularly of cases with milder symptoms or no symptoms. As of the 29th of February, apart from mainland China, the epidemic had spread to several other countries around the world, with the most affected being South Korea, Italy, and Iran. National response measures have included containment measures such as quarantines and curfews. The first person known to have fallen ill due to the new virus was in Wuhan on December 1st, 2019. A public notice on the outbreak was released on the 31st of December. WHO has informed of the outbreak on the same day. By the 7th of January, the Chinese government were discussing prevention and control of COVID-19. A quarantine was announced on the 23rd of January, stopping travel in and out of Wuhan. Private vehicle use was banned in the city. Chinese New Year, the 25th of January, celebrations were canceled in several places. On the 26th of January, the Communist Party and the government instituted further measures to contain the COVID-19 outbreak, including health declarations for travelers and changes to national holidays. The leading group decided to extend the Spring Festival holiday to contain the outbreak. Universities and schools around the country were also closed. The regions of Hong Kong and Macau instituted several measures, particularly in regard to schools and universities. Remote working measures were instituted in several Chinese regions. Various travel restrictions were enacted. Other provinces and cities outside Hubei imposed travel restrictions. Public transport was modified, and museums throughout China were temporarily closed. Some experts doubted the accuracy of the number of cases reported by the Chinese government, which repeatedly changed how it counted coronavirus cases. A quarantine restricting travel for Wuhan residents, involving changes to flights, trains, public buses, the metro system, long-distance coaches, large-scale gatherings, and group tours. Several Chinese cities were placed under quarantine measures. People in numerous regions bought excess supplies of goods. 5 million people left Wuhan during the start of the quarantine. Several Chinese cities committed to not imposing similar quarantine measures, while others enacted them. On the 1st of February, Huanggang, Hubei implemented a measure whereby only one person from each household is permitted to go outside for provisions once every 2 days, except for medical reasons or to work at shops or pharmacies. Many cities, districts, and counties across mainland China implemented similar measures in the days following, including Wenzhou, Hangzhou, Fuzhou, Harbin, and the whole of Jiangxi. A specialty hospital named the Huashinshan Hospital with 1,000 beds was constructed, while on Jiaotingshan Hospital, fabricated for the SARS outbreak of 2003. 14 temporary hospitals were constructed in China in total, but all were reported to have closed after the crisis was determined to be under control on the 10th of March. The outbreak was confirmed to have spread to Italy on the 31st of January, when 2 Chinese tourists tested positive for SARS-CoV-2 in Rome. In response, the Italian government suspended all flights to and from China and declared a state of emergency. On the 31st of January, the Italian Council of Ministers appointed Angelo Borelli, head of the Civil Protection, as special commissioner for the COVID-19 emergency. An unassociated cluster of COVID-19 cases was later further detected, starting with 16 confirmed cases in Lombardy on the 21st of February. On the 22nd of February, the Council of Ministers announced a new decree law to contain the outbreak, including quarantining more than 50,000 people from 11 different municipalities in northern Italy. Prime Minister Giuseppe Conte said in the outbreak areas, entry and exit will not be provided. Suspension of work, activities, and sports events has already been ordered in those areas. On the 4th of March, the Italian government ordered the full closure of all schools and universities nationwide as Italy reached 100 deaths. All major sporting events, including Serie A football matches, will be held behind closed doors until April. On 9th of March, all sport was suspended completely for at least 1 month. On the 11th of March, Prime Minister Conte ordered stoppage of nearly all commercial activity except supermarkets and pharmacies. On the 6th of March, the Italian College of Anesthesia, Analgesia, Resuscitation, and Intensive Care published medical ethics recommendations regarding triage protocols that might be employed. As of the 13th of March, there has been 21,157 confirmed cases, 1,441 deaths, and 1,966 recoveries in Italy. On the 21st of February, at least 10 towns in the Lombardy and Veneto regions of Italy, with a total population of 50,000, were locked down in quarantine procedure following an outbreak in Condogno in Lombardy. Police mandated a curfew, closing all public buildings and controlling access through police checkpoints to the so-called red zone, which is enforced by penalties for violations ranging from a €206 fine to 3 months of imprisonment against trespassers who are not healthy or supply workers. The governor of Basilicata, Vito Bardi, instituted a mandatory 14-day quarantine for people arriving from areas in northern Italy affected by the outbreak on the 24th of February. On the 8th of March, Conte said that much of Italy's northern territories, including Milan and Venice and all of the populous Lombardy region, will be quarantined with their region, with movement restrictions affecting about 16 million people. This will be the most aggressive response taken in any region beyond China and will paralyze the wealthiest parts of the country as Italy attempts to constrain the rapid spread of the disease. At the time of Conte's announcement, it was reported that there were 7,375 confirmed cases and 366 deaths in Italy. On the evening of the 9th of March, the quarantine was expanded to all of Italy. South Korea confirmed its first case on the 20th of January. There was a large increase in cases on the 20th of February, potentially attributable to a gathering in Daegu of a new religious movement known as the Shincheonji Church of Jesus. A hospital was suspected by some as propagating the outbreak. As of the 22nd of February, among 9,336 followers of the church, 1,261 reported symptoms. A petition was circulated requesting the church's disbandment. On the 20th of February, over 2,000 confirmed cases were reported, rising to 3,150 on the 29th of February. All South Korean military bases were on quarantine after tests confirmed that 3 soldiers were indeed positive for the virus. Airline schedules were also affected and therefore they were changed. North Korea closed its border with China in January. The North Korea government officially denied to the WHO that they had any cases, but South Korean sources estimate at least 180 to 200 deaths among the army alone, not counting those among the civilian population. There is no estimate of those merely infected. Iran reported its first confirmed cases of SARS-CoV-2 infections on the 19th of February in Qom. where, according to the Ministry of Health and Medical Education, 2 people had died later that day. Early measures announced by the government include the cancellation of concerts and other cultural events, sporting events, and Friday prayers, closure of universities, higher education institutions and schools, and allocated 5 trillion rials to combat the virus. President Hassan Rouhani said on 26 February 2020 that there were no plans to quarantine areas affected by the outbreak, and only individuals would be quarantined. Shia shrines in Qom remained open to pilgrims. Iran became a center of the spread of the virus after China. Amidst claims of a cover-up of the extent of the outbreak in the country, over 10 countries have traced their cases back to Iran by the 20th of February, indicating that the extent of the outbreak may be more severe than the 388 cases reported by the Iranian government by that date. The Iranian parliament was shut down, with 23 of the 290 members of parliament reported to have had tested positive for the virus on the 3rd of March. A number of senior government officials, as well as 2 members of parliament, have died from the disease. On the 31st of January, the Trump administration limited entry into the United States, as immigrants or non-immigrants of all aliens who are physically present within the People's Republic of China, excluding the special administrative regions of Hong Kong and Macau, during the 14-day period preceding their entry or attempted entry into the United States. In the Pacific Northwest state of Washington, the first death in the United States was reported on the 29th of February after an outbreak at a Life Care Centers of America elderly care in Kirkland, Washington, following which Washington Governor Jay Inslee declared a state of emergency. Florida and California also declared a state of emergency in early March. Major U.S. corporations, including Amazon, Facebook, Twitter, and Goldman Sachs, have imposed employee travel restrictions, and some have canceled conferences. Some companies, including Microsoft, GitHub, and Square Incorporated, have also encouraged employees to work from home. Many major U.S. sports leagues canceled scheduled events. The National Basketball Association, NBA, suspended the 2019 to 2020 season indefinitely. The decision came minutes after the Utah Jazz informed league officials prior to tip-off of their 11th March game against the Oklahoma City Thunder that center Rudy Gobert had tested positive for COVID-19. On the 12th of March, the Major League Soccer, MLS, and Major League Rugby, MLR, announced their 2020 seasons would be suspended for 30 days. The National Hockey League, NHL, suspended play of the 2019 to 2020 season. Major League Baseball announced it would be suspending operations, including the remaining spring training games, and delaying the start of the 2020 season for at least 2 weeks. The NCAA initially announced that the NCAA Men's Division I basketball tournament would take place without fans in attendance. However, on the 12th of March, it was announced the event would be canceled. The XFL initially announced certain games to be played without fans in attendance, but later suspended the season. Both the Indian Wells Masters and Miami Open, 2 major American tennis tournaments, were canceled. Travelers at Hartsfield-Jackson Atlanta International Airport were wearing face masks. Over a dozen schools in the Seattle area canceled classes on the 3rd of March for disinfection and other precautionary measures. On the 6th of March, the University of Washington canceled in-person classes. The Seattle-based university is home to 50,000 students. Multiple public and private schools outside New York City have closed. All schools within the Elk Grove Unified School District in the Sacramento area shut down on the 7th of March after a case of the virus appeared in Elk Grove. On the 11th of March, President Trump announced the suspension of most travel from Europe, excluding the United Kingdom, for 30 days, beginning on the 13th of March. He also said that health insurance companies have agreed to waive all co-payments for coronavirus treatment and extend insurance coverage to cover coronavirus treatments. The Department of Homeland Security clarified that this travel suspension only applied to the Schengen area. It does not apply to European countries that are not members of the Schengen Agreement, such as the United Kingdom, the Republic of Ireland, Croatia, Albania, or Belarus. Furthermore, the travel ban does not apply to U.S. citizens or permanent residents or their family members or those traveling on certain types of visa. In addition, a representative of the insurance industry clarified that, contrary to the president's statement, major health insurers had only agreed to waive co-payments for coronavirus testing and not for coronavirus treatment, which is far more costly. As of the 14th of March, the epidemic was reported to be present in 47 of the 50 states, plus the District of Columbia. The number of confirmed cases in the U.S. was at 2,340 with 50 deaths. On the 13th of March, U.S. President Trump declared a national emergency due to the virus outbreak. This action makes federal funds available to respond to the crisis. The 2019 to 2020 coronavirus pandemic was confirmed to have spread to Japan on the 23rd of January 2020 from China. On the 27th of February 2020, Prime Minister Shinzo Abe requested that all Japanese elementary, junior high, and high schools close until early April to help contain the virus. The outbreak has been a concern for the 2020 Summer Olympics, which is scheduled to take place in Tokyo starting at the end of July. The Japanese government has thus been taking extra precautions to help minimize the outbreak's impact. The pandemic has spread to multiple other countries. In total, more than 150 territories have had at least one case. British Prime Minister Boris Johnson has largely kept the United Kingdom open, opting for a solution of herd immunity. This involves enough people getting affected upon which they develop immunity to the disease. An analysis of air travel patterns was used to map out and predict patterns of spread and was published in the Journal of Travel Medicine in mid-January 2020. Based on information from the International Air Transport Association 2018, Bangkok, Hong Kong, Tokyo, and Taipei had the largest volume of travelers from Wuhan. Dubai, Sydney, and Melbourne were also reported as popular destinations for people traveling from Wuhan. Bali was reported as least able in terms of preparedness, while cities in Australia were considered most able. There have been international comments that the 2020 Olympics should be moved from Japan or postponed. On the 22nd of January, the Asian Football Confederation, AFC, announced that it would be moving the matches in the third round of the 2020 AFC Women's Olympic Qualifying Tournament from Wuhan to Nanjing, affecting the women's national team squads from Australia, China PR, Chinese Taipei, and Thailand. A few days later, the AFC announced that together with Football Federation Australia, they would be moving the matches to Sydney. The Asia Pacific Olympic boxing qualifiers, which were originally set to be held in Wuhan from the 3rd to 14th of February, were also cancelled and moved to Amman, Jordan, to be held between the 3rd and 11th of March. Australia released its emergency response plan for novel coronavirus COVID-19 on the 7th of February. It states that much is yet to be discovered about COVID-19 and that Australia will emphasize border control and communication in its response to the pandemic. As a result of the outbreak, many countries and regions, including most of the Shenzhen area, Armenia, Australia, India, Iraq, Indonesia, Kazakhstan, Kuwait, Malaysia, Maldives, Mongolia, New Zealand, Philippines, Singapore, Sri Lanka, Taiwan, Vietnam, and the United States have imposed temporary entry bans on Chinese citizens or recent visitors to China, or have ceased issuing visas and reimposed visa requirements on Chinese citizens. Samoa even started refusing entry to its own citizens who have previously been to China, attracting widespread condemnation over the legality of such a decision. The European Union rejected the idea of suspending the Shenzhen Free Travel Zone and introducing border controls with Italy, although Austria instituted border checks on the border it shares with Italy. The United States suspended travel from the Shenzhen area. Many countries then started closing their borders to virtually all non-citizens or non-residents in rapid succession, including India, Slovakia, Denmark, and Poland. Owing to the effective quarantine of public transport in Wuhan and Hubei, several countries have planned to evacuate their citizens and diplomatic staff from the area, primarily through chartered flights of the home nation that have been provided clearance by Chinese authorities. Canada, the United States, Japan, India, France, Australia, Sri Lanka, Germany, and Thailand were among the first to plan the evacuation of their citizens. Pakistan has said that it will not be evacuating any citizens from China. On the 7th of February, Brazil evacuated 34 Brazilians or family members in addition to 4 Poles, a Chinese, and an Indian citizen. The citizens of Poland, China, and India got off the plane in Poland, where the Brazilian plane made a stopover before following its route to Brazil. Brazilian citizens who went to Wuhan were quarantined at a military base near Brasilia. On the same day, 215 Canadians, 176 from the first plane and 39 from a second plane chartered by the U.S. government, were evacuated from Wuhan, China, to CFB Trenton to be quarantined for 2 weeks. On the 11th of February, another plane of Canadians, 185, from Wuhan landed at CFB Trenton. Australian authorities evacuated 277 citizens on the 3rd and 4th of February to the Christmas Island Detention Center, which had been repurposed as a quarantine facility, where they remained for 14 days. A New Zealand evacuation flight arrived at Auckland on the 5th of February. The passengers, including some from Australia and the Pacific, were quarantined at a naval base at Wangaport, north of Auckland. The United States announced that it would evacuate Americans aboard the cruise ship Diamond Princess. On the 21st of February, a plane carrying 129 Canadian passengers evacuated from Diamond Princess landed in Trenton, Ontario. The Indian government has scheduled its Air Force to evacuate its citizens from Iran. On the 5th of February, the Chinese Foreign Ministry said that 21 countries, including Belarus, Pakistan, Trinidad and Tobago, Egypt, and Iran, had sent aid to China. The U.S. city of Pittsburgh announced plans to send medical aid to Wuhan, which is its sister city. The University of Pittsburgh Medical Center, UPMC, also announced plans to provide help. Some Chinese students at other American universities have also joined together to help send aid to virus-stricken parts of China, with a joint group in the greater Chicago area reportedly managing to send 50,000 N95 masks and 1,500 protection suits to hospitals in the Hubei province on the 30th of January. The humanitarian aid organization Direct Relief, in coordination with FedEx Transportation and Logistics Support, sent 200,000 face masks along with other personal protective equipment, including gloves and gowns, by emergency airlift to arrive in Wuhan Union Hospital, who requested the supplies by the 30th of January. The Gates Foundation stated on the 26th of January that it would donate $5 million in aid to support the response in China that will be aimed at assisting emergency funds and corresponding technical help to help frontline responders. On the 5th of January, Bill and Melinda further announced a $100 million donation to the World Health Organization, who made an appeal for funding contributions to the international community on the same day. The donation will be used to fund vaccine research and treatment efforts, along with protecting at-risk populations in Africa and South Asia. Japan, in the process of coordinating a planned flight to Wuhan to pick up Japanese nationals in the city, has promised that the plane will first carry into Wuhan aid supplies that Japanese Foreign Minister Toshimitsu Motegi stated will consist of masks and protective suits for Chinese people as well as for Japanese nationals. On the 26th of January, the plane arrived in Wuhan, donating its supply of 1 million face masks to the city. Also among the aid supplies were 20,000 protective suits for medical staff across Hubei donated by the Tokyo Metropolitan Government. On the 20th of January, the city of Mito donated 50,000 masks to a sister city of Chongqing. And on the 6th of February, the city of Okayama sent 22,000 masks to Luoyang, its sister city. The ruling Liberal Democratic Party on February 10th made a symbolic deduction of 5,000 yen from the March salary of every LDP parliamentarian, a total of 2 million yen, to donate to China, with the party's Secretary General Toshihiro Nikai saying that for Japan, when it sees a virus outbreak in China, it is like seeing a relative or neighbor suffering. Japanese people are willing to help China and hope that the outbreak will pass as soon as possible. Peace Winds Japan has declared it will send a staff member to China to help distribute the face masks and other goods that the NGO will send to the country. Other countries have also announced aid efforts. Malaysia announced a donation of 18 million medical gloves to China. The Philippine Red Cross also donated 1.4 million worth of Philippine-made face masks, which were shipped to Wuhan. Turkey dispatched medical equipment, and Germany delivered various medical supplies, including 10,000 hazmat suits. On the 19th of February, Singapore Red Cross announced that they will send $2.26 million worth of aid to China, consisting of protective material and training. The WHO has commended the efforts of Chinese authorities in managing and containing the epidemic, with Director General Tedros Adhanom Ghebreyesus expressing confidence in China's approach to controlling the epidemic and calling for the public to remain calm. The WHO noted the contrast between the 2003 epidemic, where Chinese authorities were accused of secrecy that impeded prevention and containment efforts, and the current crisis where the central government has provided regular updates to avoid panic ahead of Lunar New Year holidays. On the 23rd of January, in reaction to the central authorities' decision to implement a transportation ban in Wuhan, WHO Representative Gauden Gallia remarked that while it was certainly not a recommendation the WHO has made, it is also a very important indication of the commitment to contain the epidemic in the place where it is most concentrated, and called it unprecedented in public health history. On the 30th of January, following confirmation of human-to-human transmission outside China and the increase in number of cases in other countries, the WHO declared the outbreak a public health emergency of international concern, the sixth PHEIC since the measure was first invoked during the 2009 swine flu pandemic. Tedros clarified that the PHEIC, in this case, was not a vote of no confidence in China, but because of the risk of global spread, especially to low and middle-income countries without robust health systems. In response to the implementations of travel restrictions, Tedros stated that there is no reason for measures that unnecessarily interfere with international travel and trade, and that WHO doesn't recommend limiting trade and movement. On the 5th of February, the WHO appealed to the global community for a $675 million contribution to fund strategic preparedness of low-income countries, citing the urgency to develop those countries which do not have the systems in place to detect people who have contracted the virus even if it were to emerge. Tedros further made statements declaring that we are only as strong as our weakest link, and urged the international community to invest today or pay more later. On the 11th of February, the WHO in a press conference established COVID-19 as the name of the disease. In a further statement on the same day, Tedros said that he had briefed with the UN Secretary General Antonio Guterres, who agreed to provide the power of the entire UN system in the response. A UN crisis management team was activated as a result, allowing coordination of the entire United Nations response, which the WHO states will allow them to focus on the health response, while the other agencies can bring their expertise to bear on the wider social, economic, and developmental implications of the outbreak. On the 14th of February, a WHO-led joint mission team with China was activated to provide international and WHO experts to touch ground in China to assist in the domestic management and evaluate the severity and the transmissibility of the disease by hosting workshops and meetings with key national-level institutions to conduct field visits to assess the impact of response activities at provincial and county levels, including urban and rural settings. On the 25th of February, the WHO declared that the world should do more to prepare for a possible coronavirus pandemic, stating that while it was still too early to call it a pandemic, countries should nonetheless be in a phase of preparedness. In response to a developing case of outbreak of the coronavirus in Iran, the WHO has sent a joint mission team there on the same day to assess the situation in the country. On the 20th of February, WHO officials said that the coronavirus threat assessment at the global level will be raised from high to very high, its highest level of alert and risk assessment. Mike Ryan, Executive Director of WHO's Health Emergencies Program, warned in a statement that this is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens. You have a duty to the world to be ready. Urging that the right response measures could help the world avoid the worst of it. Ryan further stated that the current data does not warrant public health officials to declare a global pandemic, saying that the declaration would mean we're essentially accepting that every human on this planet will be exposed to that virus. On the 11th of March, the WHO declared the coronavirus outbreak an official pandemic. The Director General said that WHO was deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. China's response to the virus, in comparison to the 2003 SARS outbreak, has been praised by some foreign leaders. U.S. President Trump thanked Chinese leader Xi Jinping on behalf of the American people on the 24th of January on Twitter, stating that China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency, and declaring that it will all work out well. Germany's health minister Jens Spahn, in an interview on Bloomberg TV, said with comparison to the Chinese response to SARS in 2003, there's a big difference to SARS. We have a much more transparent China. The action of China is much more effective in the first days already. He also praised that international cooperation and communication in dealing with the virus. In a letter to Z, Singaporean President Halima Yaakob applauded China's swift, decisive, and comprehensive measures, and safeguarding the health of the Chinese people, while Prime Minister Lee Hsien Loong remarked of China's firm and decisive response. In communities affected by the virus, similar sentiments were expressed by Russian President Vladimir Putin. At a Sunday Mass at St. Peter's Square in Vatican City on 26 January, Pope Francis praised the great commitment by the Chinese community that has already been put in place to combat the epidemic, and commenced a closing prayer for the people who are sick because of the virus that has spread through China. Among the criticism of the central government are the disapproval of local Hubei and Wuhan government, as well as censorship of information on the early phases of the outbreak. The earlier response by the Wuhan authorities was criticized as prioritizing a control of information that might be unfavorable for local officials over public safety, and the Chinese government was also criticized for cover-ups and downplaying the initial discovery and severity of the outbreak. By the time China had informed the WHO of the new coronavirus on the 31st of December, the New York Times reported that the government was still keeping its own citizens in the dark. Observers have also blamed the institutional censorship and structure of the country's press that left senior officials with inaccurate information on the outbreak and contributed to a prolonged period of inaction that allowed the virus to spread. The Human Rights Watch noted that censorship was extended to social media posts from families of infected people seeking help, as well as by people living in cordoned cities who are documenting their daily lives amidst the quarantine. On the 1st of January 2020, a group of 8 medical personnel, including Li Wenliang, an ophthalmologist from Wuhan Central Hospital, were taken into custody by Wuhan police and threatened with prosecution for spreading false information, for characterizing the new infection as SARS-like. Li Wenliang, who informed his former medical school classmates of the coronavirus akin to SARS in a WeChat group after examining a patient's medical report with symptoms of the illness, was warned by the police on the 3rd of January for making untrue comments that had severely disturbed the social order, and made to sign a statement of acknowledgement. Li later died of the disease on the 7th of February, which provoked widespread public anger described as one of the biggest outpourings of online criticism of the government in years. But some of the trending hashtags on Weibo, such as Wuhan government owes Dr. Li Wenliang an apology and we want freedom of speech, were blocked. One media outlet sent notices to editors asking them to not to comment or speculate on Li's death, and giving instructions to not hashtag and let the topic gradually die out from the hot search list, and guarding against harmful information. China's anti-corruption body, the National Supervisory Commission, has initiated an investigation into the issues involving Li. On the 14th of January, Wuhan police detained several Hong Kong media correspondents for over an hour when they were conducting interviews at Wuhan's Xinyantan Hospital. Reports said the police brought the correspondents to a police station, where the police checked their travel documents and belongings and asked them to delete video footage taken in the hospital before releasing them. On the 20th of January, Chinese Communist Party General Secretary Xi Jinping made his first public remark on the outbreak and spoke of the need for the timely release of information. However, Xi Jinping later also instructed authorities to strengthen the guidance of public opinions, language some viewed as a call for censorship. As part of the central government's bifurcated approach to diffuse discontent, citizens were permitted to criticize local officials as long as they did not question the basic legitimacy of the party. The Cyberspace Administration, CAC, declared its intent to foster a good online atmosphere, with CAC notices sent to video platforms encouraging them to not to push any negative story and not to conduct non-official live streaming on the virus. Censorship was briefly relaxed, giving a window of about 2 weeks in which Chinese journalists were able to publish hard-hitting stories exposing the mishandling of the novel coronavirus by officials. But later, news outlets were reportedly required to use planned and controlled publicity with the authorities' consent. On the 30th of January, Chinese Supreme Court delivered a rare rebuke against the country's police forces, calling the unreasonably harsh crackdown on online rumors as undermining public trust, and said that such online posts would allow the public to adopt measures that can help counter the spread of the virus. Local officials in Wuhan and the province of Hubei have faced criticism, both domestically and internationally, for mishandling the initial outbreak. Allegations include insufficient medical supplies, hiding evidence of human-to-human transmission in early January, and lack of transparency to the press and censorship of social media during People's Congress meetings for political reasons during the initial weeks of the outbreak. Criticism was directed at Hubei Governor Wang Xiaodong after he twice claimed at a press conference that 10.8 billion face masks were produced each year in the province, rather than the accurate number of 1.8 million. Authorities in Wuhan and Hubei provinces have been criticized for downplaying the severity of the outbreak and responding more slowly than they could have. The Beijing-based media journal Caixin noted that Hubei did not roll out the first level of public health emergency response mechanism until the 24th of January, while several other provinces and cities outside the center of the outbreak had already done so the day before. John McKenzie, a senior expert at WHO, accused them of keeping the figures quiet for a while because of some major meeting they had in Wuhan, alleging that there was a period of very poor reporting or very poor communication in early January. On the 19th of January, 4 days before the city quarantine, a Wanxiaoyan was held in Wuhan. With over 40,000 families turning out, this attracted retrospective criticism. The Beijing News argued that local authorities should not have held such a public assembly while attempting to control the outbreak. The paper also stated that when their journalists visited the Huanan seafood wholesale market, where the coronavirus likely originated, most residents and merchants there were not wearing face masks. Xiao Jianwang, the mayor of Wuhan, later spoke to China Central Television, explaining that the banquet was held annually, that is a sample of the people's self-autonomy, and that the decision was made based on the fact that scientists then wrongly believed that the virus's ability to spread between humans was limited. Meanwhile, on the 20th of January, Wuhan's Municipal Department for Culture and Tourism gave out 200,000 tickets valid for visiting all tourist attractions in Wuhan to its citizens for free. The department was later criticized for disregarding the outbreak. Tang Zihong, the chief of the health department in Huanggang, was fired hours after she was unable to answer questions on how many people in her city were being treated. In contrast to the widespread criticism of the local response, the central government has been praised by international experts and state media for its handling of the crisis. This has led to suggestions that it is an attempt by the state media to shift public anger away from the central government and towards local authorities. It has been noted historically that the tendency of provincial governments to minimize reporting local incidents have been because of the central government directing a large proportion of the blame onto them. Critics such as Wu Jiang, a former professor at Tsinghua University, and Steve Tsang, director of the China Institute at the University of London, have further argued the same point, with the latter suggesting that it was also exacerbated through local officials being apprehensive about taking sensible preventive measures without knowing what Xi Jinping and other top leaders wanted, as they feared that any missteps would have serious political consequences, a sentiment that Tsang argued was difficult to avoid when power is concentrated in the hands of one top leader, who is punitive to those who make mistakes. Wuhan Mayor Zhao Jianwang defended himself, referring to the suggestions by publicly blaming regulatory requirements that require local governments to first seek Beijing's approval, which delayed disclosure of the epidemic. He stated in an interview that as a local government, we may disclose information not only after we are given permission to do so. That is something that many people do not understand. In Xi's place, Premier Li Keqiang was dispatched to oversee epidemic control and prevention, with some suspecting that Li was a convenient political scapegoat. This led to suggestions that the ruling party and state media were attempting to limit the risk of political fallout to Xi during this crisis. The governing party's censorship and propaganda have fueled mistrust on their handling of the outbreak, particularly among young people. The Chinese government has also been accused of rejecting help from the CDC and the WHO. Insiders at the US CDC complained that China would not agree to on-site visits, while it took 2 weeks for Chinese authorities to approve an international mission team led by Dr. Bruce Aylward, but the team composition and scope of the work was still yet to be determined. The Ministry of Health and Welfare has been criticized for unilaterally implementing telephone consultation and prescription without discussing with the Korean Medical Association, and for not restricting traffic from China despite several warnings from the association and a petition proposed by the society. On the 22nd of February, the South Korean government apologized for calling the virus Daegu COVID-19 in an official report. The term has been widespread on social media and raises concern about discrimination. More than 1.5 million South Koreans have decided a petition to impeach President Moon Jae and over what they claim is the government's mishandling of the outbreak. On the 6th of March, the South Korean government has only entry restricted Japanese citizens out of 102 countries that blocked Korea. The action has been widespread on social media and raises concerns about anti-Japanese discrimination. Diplomatic relations between Japan and South Korea worsened, as South Korea criticized Japan's ambiguous and passive quarantine efforts. Under the post-war constitution, Japanese people are guaranteed a significant amount of freedoms and individual rights. Hence, the government does not have powers that can restrict movement in the same manner that Italy and the People's Republic of China can. The government does not have the power to quarantine domestic patients or impose curfews. Japan's Ministry of Health, Labor, and Welfare has been criticized for a perceived delayed response. Critics have observed that while Japan announced the first case of infection on the 20th of January, it took until the 17th of February for the health ministry to inform the public on how to reach public screening centers, and the 25th of February for the government to issue a basic policy on outbreak response. The overdue response times of the government has led critics to accuse Abe of callous indifference in the face of an unfolding disaster, and the government as a whole as being out of touch with the lives of ordinary people, that they seem genuinely uninterested in their plight. The strict constraints on testing for the virus by Japanese health authorities have drawn accusations from critics such as Masahiro Kami, a physician and director of the Medical Governance Research Institute, towards Abe of wanting to downplay the number of infections or patients because of the upcoming Olympics. Reports that only a small select number of public health facilities were authorized to test for the virus, after which the results could only be processed by 5 government-approved companies, has created a bottleneck where clinics have been forced to turn away even patients who had high fevers. This has led some experts to question Japan's official case numbers, with Tobias Harris of Teneo Intelligence in Washington, D.C., stating, "You wonder, if they were testing nearly as much as South Korea is testing, what would the actual number be? How many cases are lurking and just aren't being caught?" The quarantine measures on the cruise ship Diamond Princess has also been criticized after the ship proved a fertile breeding ground for the virus. Kentaro Iwata, an infectious disease professor at Kobe University Hospital, said that the condition aboard was completely chaotic and violating all infection control principles. A preliminary report by Japan's National Institute of Infectious Disease, NIID, estimated that most of the transmission on the ship had occurred before the quarantine, based on the first 184 cases. On the 22nd of February, the Health Ministry admitted that 23 passengers were disembarked without being properly tested for the virus. On the 23rd of February, a Japanese woman had tested negative before disembarking from the cruise ship, later tested positive after returning to her home in Tochigi Prefecture. She was not among the 23 passengers. Iranians criticized government authorities for proceeding with elections while disease was spreading and closing secular spaces while keeping shrines open, especially in the Shia holy city of Qom. Asif Shuja of the National University of Singapore's Middle East Institute suggested that the fact that Iran reported deaths on the same day as its first infections, right before its parliamentary elections, can compel anyone that there has been a cover-up. Scrutiny has also been targeted at the government's unwillingness to implement area-wide quarantine measures like those implemented by China and Italy, with Iranian officials calling quarantines old-fashioned. There have been concerns that the Iranian government's official counts were an underestimate. The WHO's Director General, Tedros Adhanom Ghebreyesus, said that the WHO has its own mechanism for checking facts and has not seen problems with Iran's reported figures. Italy's government has drawn criticism from scientists and WHO for its decision to suspend direct flights to mainland China that, while sounding tough on paper, was ineffective as people could still arrive from risk areas via indirect routes. Walter Ricciardi, a professor of hygiene and public health at the University Cattolica del Sacro Cuore in Rome, and a member of the European Advisory Committee on Health Research, has said, "Italy was wrong. Closing flights from China is of no use when there are indirect ones." Criticism followed disclosures by Italian Prime Minister Giuseppe Conte that protocols had not been followed at the hospital in Condagno, Lombardy that treated patient 1 would certainly contribute to the spread of the virus in Italy, with Conte responding to inquiries by journalists on what protocol was broken with, "This is not the time for controversy." In response to a statement by Conte that the central government may need to revoke regional health policy powers, President of Lombardy, Attilio Fontana, called Conte's statement fascist and talking nonsense. The U.S. government has received criticism toward the Centers for Disease Control and Prevention and the Trump administration's response to the coronavirus outbreak. The CDC has been criticized for a number of problems and failings in its approach to the novel coronavirus outbreaks. Among the issues include a large number of faulty coronavirus test kits sent out to localities throughout the United States, a woefully low number of tests being done, 3,600 as opposed to over 65,000 in South Korea, a country with a much smaller population, contamination of the lab dealing with the new coronavirus, and removal of the running tally of the number of people tested from its website, which leads to allegations of a cover-up. The CDC was also surrounded in controversy after a suspected patient who was refused a SARS-CoV-2 test by the CDC was later found to be harboring the virus. Timothy Stenzel, the director of the Office of In Vitro Diagnostics and Radiological Health, called what he saw during his tour of CDC facilities alarming. The HHS launched an investigation into delays in the relatively slow response of the United States in contrast to countries in Asia. Its handling of the evacuees from Wuhan and the British cruise ship Diamond Princess was also criticized when one of the evacuees, who was released by the CDC and intermingled with the public, later turned out to be positive and infected. The Trump administration has launched an investigation into the shortcomings of the CDC. It has also ordered that the manufacture of test kits be moved away from the CDC. The Trump administration has come under criticism for its proposed cuts to overall health funding in 2018. Cuts to CDC slashed 80% of its global disease outbreak program, forcing the 4-year program to reduce its operation from 49 countries to 10. In its fiscal 2020 budget, the Trump administration promotes eliminating funding for epidemiology and laboratory capacity at state and local levels. A $30 million complex crises fund had also been cut entirely, which would have allowed the State Department to fund deployment of disease experts in the event of outbreaks. In May 2018, Trump's then National Security Advisor John Bolton disbanded a National Security Council Global Health Security Team set up to lead the American response to a pandemic. While the CDC has announced plans to screen people for the coronavirus, only 3 of the 100 public health labs were reported to be fitted for that role even after delays, which have been attributed to the agency's funding cuts. Trump has been further criticized for proposing further cuts to the CDC and National Institute of Health budgets, pegged at 16% and 10% respectively. In a released 2021 white paper, seemingly during the midst of the outbreak on the 11th of February, the proposed budget also called for a $65 million cut to the U.S.'s contribution to funding for the WHO. In response to the criticisms of the administration's handling of the crises, Mick Mulvaney, the White House's acting chief of staff, in a speech to a conservative audience event, accused the U.S. media of being overly critical and of stoking virus fears in the hopes that this is going to bring down the president. On the 20th of February, Trump asserted Democrats were promoting a new hoax to harm him politically, and that the press was in hysteria mode, while attempting to link the outbreak to Democratic immigration policies. When Trump appointed Vice President Mike Pence to head the country's response to coronavirus, he touted his experience with quelling an epidemic of HIV in Indiana and misrepresented Pence's role in which he deliberately delayed his state's government's response to the disease, despite the recommendations of the CDC that needle exchanges were an efficacious approach to reining in the spread of diseases. When he was governor of Indiana, Pence told lawmakers he would veto any bill they might pass that provided for such exchanges. After the WHO announced that the virus had a 3.4% mortality rate out of officially confirmed cases, Trump stayed on live national television, shared his opinion that this was a false number, and that based on a hunch, he believed the true figure was under 1%. Anthony S. Fauci, the director of the National Institute of Allergy and Infectious Diseases, said that a plausible COVID-19 total fatality rate out of all COVID-19 infections, including ones not formally diagnosed, could be 1%, which is 10 times as lethal as seasonal influenza. Fox pointed out that the case fatality rate of a disease is time and population dependent, and that the number could change. The World Bank has been criticized for the slow response of its Pandemic Emergency Financing Facility, PEF, a fund which was created to provide money to help manage pandemic outbreaks. The terms of the PEF, which is financed by bonds sold to private investors, prevent any money from being released from the fund until 12 weeks after the outbreak was initially detected. The novel coronavirus outbreak met all other requirements for the fund to be released in January 2020. Critics have argued that the terms of the PEF are too stringent, and the 12-week delay means that the funding will be much less effective than if it was released to assist governments in initially containing the outbreak. They argue that the fund prioritizes the interests of the private bondholders over public health. The WHO's handling of the epidemic has come under criticism amidst what has been described as the agency's diplomatic balancing act between China and China's critics. This has included scrutiny of the relationship between the agency and Chinese authorities. Initial concerns include the observation that while WHO relies upon data provided and filtered by member states, China has had a historical aversion to transparency and sensitivity to international criticism. The WHO and some world leaders have praised the Chinese government's transparency in comparison to the 2003 SARS outbreak. Others, including John McKenzie of the WHO's Emergency Committee and Anne Schuchat of the U.S. CDC, have shown skepticism, suggesting that China's official tally of cases and deaths may be underestimates. David Heyman, professor of infectious disease epidemiology at the London School of Hygiene and Tropical Medicine, said that China has been very transparent and open in sharing its data. They're sharing it very well, and they opened up all their files to the WHO delegation that arrived in Wuhan on the 22nd of February. Responding to criticism of his earlier approval of China's efforts, WHO Director General Tedros stated that China doesn't need to be asked to be praised. China has done many good things to slow down the virus. The whole world can judge. There's no spinning here. And further stating that, I know there is a lot of pressure on WHO when we appreciate that China is doing, but because of pressure, we should not fail to tell the truth. We don't say anything to appease anyone, it's because it's the truth. Tedros also suggested that the WHO would later assess whether China's actions were evidence-based and reasonable, saying, "We don't want to rush now to blaming. We can only advise them and them that whatever actions they take should be proportionate to the problems," and that's what they assured us. Some observers have framed the WHO as being unable to risk antagonizing the Chinese government, as otherwise the agency would not have been able to stay informed on the domestic state of the outbreak and influence response measures there, after which there would have likely have been a raft of articles criticizing the WHO for needlessly offending China at a time of crisis and hamstringing its own ability to operate. Through this, experts such as Dr. David Nabarro have defended the strategy in order to ensure Beijing's cooperation in mounting an effective global response to the outbreak. Osman Dar, director of the One Health Project at the Chatham House Center on Global Health Security, defended WHO's conduct, saying that the same pressure was one that UN organizations have always had from the advanced economies. The WHO's daily situation reports recognize Taiwan as a part of China, with the result of Taiwan receiving the same very high risk rating as the mainland by the WHO, despite only having a relative small number of cases on the ROC governed island. This has led to Taiwan receiving travel bans from other countries. Furthermore, as Taiwan has been excluded from the WHO due to pressure from Beijing after the Tsai's 2016 election, the state may be vulnerable in the case of an outbreak in that territory without proper channels to the WHO. Taiwan President Tsai Ing-wen called on the WHO to allow Taiwanese experts to participate in the dialogue and for the WHO to share data on the virus, even if it was not possible to admit Taiwan as a member state. In response, the WHO has said that they have Taiwanese experts involved in all of our consultations, so they're fully engaged and fully aware of all the developments in the expert networks. After urging from Japan, the US, and the UK, Taiwan was granted participation with Beijing's agreement, who deemed it necessary under the circumstances to let Taiwan participate in sharing information on the virus. Taiwan has called the move a meaningful development in response. Some Taiwanese political observers have used such criticism of the WHO as more politics than real needs, suggesting that even though we are not in WHO, we can still get this info from many other places. Although some European politicians have called for Europe's international borders to be temporarily closed, the European Union decided to turn down the idea of suspending the Schengen free travel area and introducing border controls with Italy. The deputy leader of the Swiss Ticino League, Lorenzo Quadri, criticized the decision. It is alarming that the dogma of wide open borders is considered a priority. United States President Donald Trump said the European Union had failed to take the same precautions and restrict travel from China and other hotspots as the US had implemented. Czech Prime Minister Andrej Babiš stated that European countries cannot ban the entry of Italian citizens within the Schengen area. The only possible way is to have the Italian Prime Minister call on his fellow citizens to refrain from traveling to other countries of the European Union. After Czech Republic, Slovakia, Poland, and Denmark announced complete closure of their national borders, European Commission President Ursula von der Leyen said that certain controls may be justified, but general travel bans are not seen as being the most effective by the World Health Organization. Moreover, they have a strong social and economic impact. They disrupt people's lives and business across the borders. Politico reported that EU countries have so far refused Italy's plea for help fighting coronavirus, as national capitalists worry that they may need to stockpile face masks and other medical gear to help their citizens, officials, and diplomats, said owing to the urgency of the epidemic. Many scientific publishers made scientific papers relating to the outbreak available with open access. Some scientists chose to share their results quickly on preprint servers such as bioRxiv, while archivists created an open access database of over 5,000 papers about coronaviruses, which they downloaded from Sci-Hub. In addition, the platform Outbreak Science Rapid PRE Review was launched in order to perform rapid open peer review of preprints related to emerging outbreaks. Medical care providers, including intensivists and pulmonologists involved in the free open access medicine movement, rapidly compiled both disease information and treatment procedures in the Internet Book of Critical Care, which was quickly circulated by institutions including Princeton and UPenn. Interactive computing games have also been used to help with designing and identifying proteins that may be able to bind to and neutralize the SARS-CoV-2 spike protein that is used to invade host cells. The scientists hope that players' creations will yield insights that will allow them to create an effective antiviral therapy for COVID-19. Foldit is an online video game that challenges players to fold various proteins into shapes where they are stable. Players, who can work alone or in teams, are using the game's puzzle system to develop new protein structures that can be tested by biochemists in the lab for use in antiviral drugs. Whistleblowing from various Chinese doctors, including Li Wenliang, on the 30th of December, revealed that Wuhan hospital authorities were already aware that the virus was a coronavirus and patients were already placed under quarantine. However, news of the outbreak was dismissed as rumor mongering by the Wuhan Public Security Bureau due to factual inaccuracies in early posts, such as Li Wenliang's controversial WeChat post. The Wuhan Health Commission insisted that the illness spreading in Wuhan at the time was not SARS on the 5th of January. In the early stages of the outbreak, Chinese National Health Commission said that they had no clear evidence of human-to-human transmissions. The White House has been accused for downplaying the threat and censoring and controlling the messages published by directing health officials and scientists according all statements and public appearances, with the office of Mike Pence before publishing all coronavirus-related communications. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, told the New York Times that he was instructed by the White House not to talk about the coronavirus without clearance. On the 4th of March, the Centers for Disease Control and Prevention of the United States deleted the running tally of the number of people tested for the coronavirus across the U.S. from its website. President of the United States, Donald Trump, has vowed to keep the numbers low, leading to claims that he is trying to limit the magnitude of the published statistics. Allegations of a cover-up and concerns has risen that the deletion could possibly limit the country's response to the epidemic. After the initial outbreak, conspiracy theories and misinformation spread online regarding the origin and scale of the Wuhan coronavirus. Various social media posts claimed the virus was a bioweapon, a population control scheme, or the result of a spy operation. Google, Facebook, and Twitter announced that they would take stringent measures against possible misinformation. In a blog post, Facebook stated that they would remove content flagged by leading global health organizations and local authorities that violates its content policy on misinformation leading to physical harm. On the 2nd of February, the WHO declared that there was a massive infodemic accompanying the outbreak in response, citing an overabundance of reported information, accurate and false, about the virus that makes it hard for people to find trustworthy sources and reliable guidance when they need it. The WHO stated that the high demand for timely and trustworthy information has incentivized the creation of a direct WHO 24/7 myth-busting hotline, where its communication and social media teams have been monitoring and responding to misinformation through its website and social media pages. Taiwanese authorities have accused 50 Cent Party's internet trolls of spreading disinformation online to sow fear and panic among Taiwanese. According to The Economist, conspiracy theories about COVID-19 being the CIA's creation to keep China down are all over the Chinese internet. On the 26th of January, Chinese military news agency Xilu published an article detailing how the virus was artificially combined by the United States to precisely target Chinese people. Zhao Lijian, a spokesman from China's Ministry of Foreign Affairs, tweeted in March of 2020 that the disease may have been introduced by members of the American Army who visited Wuhan in October 2019. Trump's top economic advisor, Larry Kudlow, and some members of the United States Congress have been accused of giving misinformation about the coronavirus. Christopher Bowsey, the founder of Bot Sentinel, made a Twitter analysis for Inverse and found that pro-Trump troll bots are making an array of false claims about the coronavirus outbreak. On the 22nd of February, U.S. officials said they have discovered Russia-linked social media accounts that deliberately promoting anti-American conspiracy theories on social media, which was denied by Russia. According to Radio Farda, Iranian cleric Syed Mohammed Saeedi accused President Trump of targeting Qom with coronavirus to fulfill his previous promise of retaliation against Iranian cultural sites. Iranian researcher Ali Akbar Raifipour claimed that the coronavirus was part of hybrid warfare program waged by the United States on Iran and China. Iran's press TV asserted that Zionist elements developed a deadlier strain of coronavirus against Iran. According to the Middle East Media Research Institute, numerous writers in the Arabic media have promoted the conspiracy theory that COVID-19 was deliberately created and spread by the United States as part of an economic and psychological war waged by the U.S. against China, with the aim of weakening it and presenting it as a backward country and a source of diseases. Some Indian politicians from Bharatiya Janata Party and Hindu Mahasabha claim that drinking cow urine and applying cow dung on the body can cure coronavirus. As of the 14th of March, more than 420 million children and youth are not attending school because of temporary or indefinite countrywide school closures mandated by governments in an attempt to slow the spread of COVID-19. 13 countries have shut schools nationwide, affecting students who would normally attend pre-primary to upper secondary classes. 9 more countries, including India, have implemented localized school closures to prevent or contain COVID-19. Even when school closures are temporary, it carries high social and economic costs. The disruptions they cause affect people across communities, but their impact is more severe for disadvantaged children and their families, including interrupted learning, compromised nutrition, childcare problems, and consequent economic costs of families who cannot work. In response to school closures caused by COVID-19, UNESCO WHO recommends the use of distance learning programs and open educational applications and platforms that schools and teachers can use to reach learners remotely and limit the disruption of education. Since the outbreak of COVID-19, heightened prejudice, xenophobia, and racism have been noted toward people of Chinese and other East Asian descent, as incidents of fear, suspicion, and hostility have been observed in many countries, particularly in Europe, North America, and the Asia-Pacific region. Some countries in Africa are seeing rising anti-Chinese sentiment as well. There has been support for the Chinese, both on and offline towards those in virus-stricken areas, but many residents of Wuhan and Hubei have reported experiencing discrimination based on their regional origin. Since the progression of the outbreak to new hotspot countries, people from Italy, the epicenter of Europe's coronavirus outbreak, have also been subject to suspicion and xenophobia. Citizens in numerous countries such as Malaysia, New Zealand, Singapore, and South Korea have signed petitions lobbying their government to ban Chinese people entering their country. Chinese people in the United Kingdom say they are facing increasing levels of racist abuse, with cases of assaults reported. Protesters in Ukraine attacked buses carrying Ukrainian and foreign evacuees from Wuhan. Students from northeast India, which shares a border with China, who study in major Indian cities, have reportedly experienced harassment related to the coronavirus outbreak. Local authorities in Bolivia quarantined Japanese nationals despite them having no coronavirus-related symptoms. In the Russian cities of Moscow and Yekaterinburg, the Chinese nationals are targeted by quarantine enforcing campaigns as well as police raids, which were condemned by human rights advocates as racial profiling. The Chinese embassy in Germany has acknowledged a rise in hostile cases against its citizens since the outbreak. Children of Asian descent were ostracized and mocked over their origins in the middle schools near Paris. Many French Vietnamese report also being subject to harassment since the coronavirus outbreak in Wuhan. On the 30th of January, the WHO's Emergency Committee issued a statement advising all countries to be mindful of the principles of Article 3 of the IHR, the International Health Regulations, which the WHO says is a caution against actions that promote stigma or discrimination when conducting national response measures to the outbreak. The coronavirus outbreak has been attributed to several instances of supply shortages, stemming from globally increased usage of equipment to fight the outbreaks, panic buying, and disruption to factory logistic operations. The FDA has issued warnings about shortages to drugs and medical equipment due to increased consumer demand and supplier disruption. Several localities, such as the United States, Italy, and Hong Kong, also witnessed panic buying that led to shelves being cleared of grocery essentials, such as food, toilet paper, and bottled water, inducing supply shortages. The technology industry, in particular, has been warning about delays to shipments of electronic goods. According to WHO Director General Tedros Adhanom, the demand for personal protection equipment has risen 100-fold, and this demand has led to an increase in prices of up to 20 times the normal price, and also induced delays on the supply of medical items for 4 to 6 months. This has also caused a shortage of personal protective equipment worldwide, with the WHO warning that this will endanger health workers. A number of provincial-level administrators of the China Communist Party were dismissed over their handling of the quarantine efforts in central China, a sign of discontent with the political establishment's response to the outbreak in those regions. Some commentators have suggested that outcry over the disease could be a rare protest against the CCP. Protests in the special administrative region of Hong Kong have strengthened due to fears of immigration from mainland China. Taiwan has also voiced concern over being included in any travel ban involving the People's Republic of China due to the One China policy and its disputed political status. A few countries have been using the epidemic to build political bridges with Beijing, raising accusations that these countries, which include Cambodia among others, were putting politics before health, attempting to use the outbreak to show tribute to the CCP. Existing tensions between the US and China may have delayed a coordinated effort to combat the outbreak in Wuhan. As mainland China is a major economy and a manufacturing hub, the viral outbreak has been seen to pose a major destabilizing threat to the global economy. Agathe Demarais of the Economist Intelligence Unit has forecast that markets will remain volatile until a clearer image emerges on potential outcomes. Some analysts have estimated that the economic fallout of the epidemic on global growth could surpass that of the SARS outbreak. One estimate gives a $300+ billion impact on world supply chain that could last up to 2 years. Organization of the petroleum exporting countries reportedly scrambled after a steep decline in oil prices due to the lower demand from China. Global stock markets fell on the 24th of February due to a significant rise in the number of COVID-19 cases outside mainland China. On the 27th of February, due to mounting worries about the coronavirus outbreak, various U.S. stock indexes, including the Nasdaq 100, the S&P 500 index, and the Dow Jones Industrial Average, posted their sharpest falls since 2008, with the Dow falling 1,191 points, the largest one-day drop since the financial crisis of 2007 to 2008. All three indexes ended the week down more than 10%. On the 20th of February, Scope Ratings GmbH affirmed China's sovereign credit rating, but maintained a negative outlook. Stocks plunged again based on coronavirus fears, the largest fall being on the 9th of March 2020. Many consider an economic recession to be likely. Tourism is one of the worst affected sectors due to a sharp fall of tourists from mainland China, and travel advisories warning against travel to parts of central China, Italy, South Korea, and Iran. As a consequence, numerous airlines have canceled flights due to lower demand, including British Airways. China Eastern and Qantas, while British regional airline Flybe collapsed. Several train stations and ferry ports have also been closed. The epidemic coincided with the Chunyun, a major travel season associated with the Chinese New Year holiday. A number of events involving large crowds were canceled by national and regional governments, including annual New Year festivals, with private companies also independently closing their shops and tourist attractions, such as Hong Kong Disneyland and Shanghai Disneyland. Many Lunar New Year events and tourist attractions have been closed to prevent mass gatherings, including the Forbidden City in Beijing and traditional temple fairs. In 24 of China's 31 provinces, municipalities, and regions, authorities extended the New Year's holiday to the 10th of February, instructing most workplaces not to reopen until that date. These regions represent 80% of the country's GDP and 90% of exports. Hong Kong raised its infectious disease response level to the highest and declared an emergency, closing schools until March and canceling its New Year celebrations. Saudi Arabia has temporarily banned foreigners from entering Mecca and Medina, two of Islam's holiest pilgrimage sites, to prevent the spread of coronavirus in the kingdom. Another recent and rapidly accelerating fallout of the disease is the cancellation of major events in sports, the film industry, and other industries, such as music festivals and concerts, technology conferences, fashion shows, and sports.